My name is Mary Graham, Community Midwife in Corby. Today we're going to talk about pain relief in labour. And when I talk about pain relief, I normally divide it into two, so non-pharmaceutical measures, so non-drugs and drugs. So we'll start with the non-drug methods of pain relief. Breathing is the most important thing that you can do to help with your pain. It won't take away your pain, but it will help you cope with it a lot better. When we stub our toe, what we normally do is we hold our breath until the pain is gone. If you do that when you're in labour, you will tense all your muscles in your abdomen and your uterus, and it will make the pain worse. So the most important thing to do is carry on breathing throughout your contraction. It is good to have someone to help you breathe with you, so your partner to help you coach how to breathe. And the easiest way to do it is just take deep breaths in and blow out. There are lots of different methods of breathing, which we will cover in another video, but the most important thing to do is to breathe throughout your contractions. Another method is water. So while you're at home, it is a good idea to get into the bath. This will help ease the contractions a little bit for you, but also it will help you identify whether the contractions are the real thing or just a false start. If they're the real thing, they will continue in the bath and continue to get stronger. If it is a false start, they may just get a little bit better and the pain will ease for you. So it's a good thing to do while you're at home. But going into the hospital, bringing that with you, we do have 2 birthing pools. And when you're in the birthing pool, it does give you a sense of feeling very light, and will help the pain as well. And we will discuss water birth in another video. Paracetamol you can take when you're in the early stages of labour. It may help, it may not help, but it's worth trying, as well as your cup of tea, which obviously solves everything. Moving on to other methods, there's lots of alternative methods out there that may help with your pain, but it is a good idea to seek professional advice from any practitioner in regards to this. So things like aromatherapy, reflexology, acupuncture. I know at this time they may not be available for you to get information from, but it is another source of pain relief. Another thing that may help you along the way is some hypnobirthing techniques. And you can download lots of apps on your phone which will help guide you through some hypnobirthing techniques. Hypnobirthing is really a way of trying to train your brain into thinking about the labour pain being a positive pain rather than a horrible pain. And if you do this from quite an early stage, listen to your app every night, by the time you go into labour, it will give you some coping mechanisms. When we are out of this phase of corona, hopefully there are lots of places that you can go to actually do hypnobirthing in a class setting. But at the moment, download a hypnobirthing app and that will really help. Another form of pain relief is a TENS machine. And what a TENS machine is transcutaneous electronic nerve stimulation. And you can hire these online. They used to do them over the Tesco counter, but I don't know if they do that anymore, but it's worth trying. And what it is, it's a little box that comes with 4 pads. You put the pads just below your bra strap, 2 above your buttock area, and the machine comes with a dial 0 to 10, and also has a booster button. And what it does is releases little impulses into your body, which then stimulate your nerves to produce the body's natural pain relief. It goes from 0 to 10, so you can increase it as the pain gets worse, and then you've got your booster button as well for your contractions. So they are quite good in the very early stages of labour. Another thing is massage. So any kind of touch releases hormones into your system, which are natural pain relief. But the only place that you may like massaged at this stage is your back or the bottom of your back. Don't do your arms, your belly, your legs will be fidgety, so just your back or the bottom of your back. Any kind of touch is good, so whether it's light touch or deep massage, you will find it helpful. So another thing for you to practice along with your breathing is the massage techniques at home while you're all at home self-isolating. So going on to drug methods that you can use when you're in hospital. So as I said, paracetamol while you're at home, it may or may not help. And the first kind of pain relief that you may use in hospital is the Entonox, which is gas and air. Now Entonox is a mixture of nitrogen and oxygen, and it is laughing gas, so it may help you laugh the way throughout your labour. It may not, but it will also help you breathe throughout your contractions. It won't take all your pain away, but it will take the edge of it. It will also make you feel quite relaxed, and it will also make you feel as if you've had a few too many to drink, but just at that nice level and able to cope. It takes a few seconds to get into your system to work, but it also takes a few seconds to get out of your system if you don't like it. A good tip with your Entonox is to, while you're using it, to close your eyes and use it. And when you stop having a pain, then you must stop using it and take some normal breaths and open your eyes again. It can make you feel a little bit sick, but the more you use it, that feeling does tend to go away. It can be used all the way throughout your labour, and some ladies will use it while they're pushing. We do take it off some ladies for pushing because sometimes it interferes with the effectiveness of the pushing, but it is a really good one to start with. The next level up for your pain relief is your opioid drugs, and the opioid drugs consist of pethidine and meptid. These are a family of drugs that help your muscle relax. So again, it won't take all your pain away, but it'll take the edge of it away. And what it is an injection, so it does take about 20 minutes to get into your system. And we obviously don't know how it's going to work until it's in your system, and can last 4 to 6 hours. It can make you feel a little bit sick, so we do tend to give you an anti-sickness drug as well to take away that feeling. And what a lot of ladies describe is it helps them relax in between contractions. They wake up, deal with the contraction, and then relax in between contractions again. And we do find that a mixture of pethidine and gas and air is quite a good combination for your labour. The pethidine can be given 4 to 6 hourly, so if you do get to that stage and you feel you need something else, we can give you another dose. Meptid is very similar. Going back to the pethidine, it can cross the placenta into baby, so if we give it too soon to delivery, what you may find is that baby may be a little bit sleepy when it's born. So a little bit like you, a little bit relaxed, and it does stay in baby's system for about 48 hours. So you may think you've got a lovely chilled out baby for the first 48 hours, and then all of a sudden they wake up and show them their true colours. Meptid is a very similar drug, same family, but it's not as strong and doesn't cross the placenta as much as pethidine. So it is another option, but if it's your first baby, I would probably recommend the pethidine more than the meptid. Then moving up the next level is your epidural. So your epidural is a local anaesthetic which is put into the epidural space around the spine, and this then numbs the nerves which supply the lower part of your body. So in effect, taking any pain away that you've got in that area, so your contraction pain. With the epidural, it is a very good form of pain relief, but it does restrict you quite a bit. So you will find that you will be on the bed, you will have a drip in your arm, you'll be on the monitor all the time, and you'll have a tube in your bladder. Also, when you do choose an epidural, we do put a lovely gown on you, and we also put lovely stockings on you as well. So you'll look the height of fashion when you have an epidural. With the epidural, nowadays they are really, really good. So they are what we call PCA pump epidurals. So once the anaesthetist has done the procedure, then they set you up with a pump, and you can basically give yourself a little shot every now and then. They do lock it so that you cannot give yourself a shot every 5 minutes, but it is a good form of pain relief. The procedure itself is a blind procedure done by the anaesthetist, who is a very qualified member of staff. It's an aseptic procedure, so we don't want any infection getting into your system. And first of all, they put a local anaesthetic into the area that they're going to put the epidural. You'll feel them then pressing quite hard on your back to find the site that they need to do it. Once they identify where they need to put the epidural, they put the epidural needle into your back, which you'll feel a lot of pressure, so no pain, and then they'll thread a very fine catheter into your back, take the needle out, and the fine catheter is what they put your drugs into, and they tape it onto your back. So it is a very good form of pain relief if you feel that you're not coping very well. The midwife will also maybe suggest an epidural at some stage if she feels that your labour is not progressing very well, or that maybe she can see things that aren't going quite as well as we would like them. With pain relief, it doesn't matter if you have nothing. We're not going to give you a gold star. Likewise, we're not going to take anything away from you if you have everything. So the best thing to do is to go with the flow. Start with your gas and air. If you feel that's not working, go on to the pethidine. If you feel that's not working, then you've got another step. So go with the flow. You can have everything. You don't have to have anything. But we are there to provide you with that support, to provide you with that advice on pain relief at any stage. I'm quickly just going to go back to the non-drug methods again because I've forgotten something. Getting into an appropriate position is sometimes a really good way of easing your pain. If you are up and mobile, sitting on a birthing ball is really good. If you are really tired, going on all fours in the bed is really good. Use your partner as a support. Squatting is really good. So there's lots of different positions that you can get into which will help with the pain, but it will also help with baby moving down through the birth canal. I really do hope this has been useful, and please do post any questions that you would like answered, and we will get back to you as soon as possible on that.